Welcome to Lakeshore Focus, a weekly show highlighting challenging issues, fascinating people, and important events in our region. I'm Keith Kirkpatrick. I think we quit using the term crazy years ago when talking about people with serious psychological problems. But I think it's crazy how little we know about mental illness in all its forms and what our roles are in dealing with this issue. Here with us on the set of Lakeshore Focus are two people who address this every day. Let's welcome from Regional Mental Health, Jake Messing, who is the Director of Acute Intensive Services, and Olga Fenton, who is a Nurse Care Manager of the Integrated Care Program. I'm glad you're both here because I've got a problem I want to talk about with you. Does anybody ever start with that when they come to talk to you guys?
Absolutely, they do.
So I'm here to talk about a problem. Do they get right to it?
A lot of times they do.
Okay. Well, that's good to know. So I thought maybe just come in and say, let's play that game of guess what's wrong with me. You know?
Oh, it takes a lot of courage to come in for the first time, but by the time they come in, they're usually pretty ready to get going.
You know, you guys have been in this career really for a long time, both of you. You know, what are the kind of people you see? Just give us a taste of what kind of problems are out there these days.
Well, I've been a nurse for 30 years and working mostly in critical care and home care. I've been working with regional now for 3 years. So I've been using my critical care and medical care experience working with this population, people with mental illness. I deal a lot with people who have diabetes, high blood pressure, high cholesterol levels, that kind of thing, and also schizoaffective disorder, schizophrenia, bipolar.
So we've learned a long time ago that this stuff, psychological and the physiological stuff, really tie together quite a bit, right?
Yep, absolutely.
Okay.
Yeah, and I think one of the things that we've done over the years, and I think it's been a mistake on our part, is we've separated the two. And I think the thing that's probably the most cutting edge in our field right now is that we're kind of gluing them back together the way it belongs, that you don't just treat the psychiatric problems and ignore the physical problems, or vice versa, to deal with the physical problems and completely ignor the psychiatric problems.
Why would we have separated those? Because, I mean, it seems pretty evident to me that they fit
some
together.
Some specialization of medicine, and care is complex. So we need people who know how to really do good care for specific diseases, but so much is interrelated. And usually if you start making improvements in one area, you can make improvements in the others.
Now, mental illness covers a wide gamut of issues, right? Can you maybe help our audience understand, I mean, what is really serious and what's just kind of like everyday life stress, or when does it become an illness?
Yeah, I think that, like all illnesses, you're talking about a range here, Keith. For example, we have something called adjustment disorders. These are really mild mental illness, really not mental illness at all. It's, classic example, I had a teenager that I worked with years ago who was a superstar student. He was the captain of the football team. He was a straight A student. He was heading to be valedictorian of his class, and his parents got divorced. It was very sudden, very unexpected, and it really knocked him for a loop. He started to struggle in the classroom. He didn't do very well on the football field, and he was just really reacting to something that most of us would react pretty strongly to.
So that's kind of
and that's
adjustment.
On the mild end.
Okay.
And I mean, I saw this boy for 2 or 3 sessions, and we talked through things, and before you knew it, he was back to functioning perfectly fine. I would not classify that as mental illness. It's just dealing with something that's a big stressor in someone's lives that most people would find difficult.
But it's a continuum that
Absolutely.
You could be telling that same story and saying, and then he got into drug abuse, and then this happened, and then it became a real mental illness.
That's correct. That most people kind of, get through that and do okay, but some of us get knocked for a real loop and don't function well. And like you say, maybe he gets depressed and he doesn't graduate high school, or he gets kicked off the football team because he's starting to miss practices.
So I'll use the medical terms and say, I mean, you never know when a cold turns into pneumonia, right?
That's correct.
Or even gets worse and you have to be hospitalized. So the kind of people that you guys are seeing and that come in, that's one example. But a lot of the people you guys are seeing really have serious mental illness. Like what?
Schizophrenia, schizoaffective disorder. So these are folks that have auditory or hallucinations or stimuli that are fairly well controlled on their medication. By the time I see them, they're fairly well controlled on their medication, and because they're on their medication, sometimes we see them with increasing weight. Some of the medications cause the weight gain in some of the situations that we deal with, which is the reason why we're doing the primary care program.
So, how much of like schizophrenia and these really serious illnesses is it a physiological thing in a person? Is it a mental thing?
Yeah, I think it depends on the disorder, and frankly, we're guessing at best here, Keith. It's sort of my personal belief that the most serious mental illness out there is schizophrenia. That's what Olga was talking about, hallucinations and delusions and bizarre beliefs.
This is where people think they're Napoleon.
That's right,
okay.
Or think the FBI is out to kill them. Okay. We really think that one probably has a larger biological sort of basis than environmental. It's always that, what's caused by environment and what's caused by just, physiological things gone bad. The reason we believe that is that the rate of schizophrenia is roughly 1%. It doesn't matter if it's here in Northwest Indiana.
1% of the entire population?
The entire population.
That's a lot of people.
That's a lot of people. They're kind of a hidden population, too. You don't see them very often because they oftentimes live with family members. They're pretty isolated. They stay at home. And so, we don't realize what a large number that is unless you happen to work in a mental health center and see these folks
in
all
a
the
region
time.
like ours with about 800,000 people, you're talking 8,000 people who have that issue.
That's probably
Is
a
there
pretty
anything
accurate
like
number.
mild schizophrenia? Is there such a thing?
No, it's a serious disorder. The thing, like all medical conditions, is that the earlier we diagnose it and the earlier we treat it, the less likely it is to result in loss of functioning or the condition getting worse.
I want to go back to what you said about we really at best are kind of guessing with some of these things, or we really don't know. I mean, in 2013, we're almost 2014. How can shouldn't we be smarter than that about what's going on with people?
Well, there's a lot that we can see in the brain with different scans and even functional MRIs and that kind of thing. So we know that we can see the changes and things that are happening in the brain. It's really hard to separate out how much we can, how much is physical, how much is organic, and how the person learns how to deal with that too. For instance, a diabetic can have the physical medical illness of diabetes and learn how to manage their diabetes, learn how to do lifestyle and behavior so that they can, function really well. Same thing as, with the mental illnesses. You can have an organic functional disorder and learn how to deal with it.
That goes back to all the brain research we keep hearing about now, where they really can do these scans and kind of see what the brain looks like. Is that really helpful in telling what's going on with people?
Yeah, I think so. I mean,
you hope so, right?
Absolutely, and one of the things that we can do is we can see over a period of time what happens to the brain. And I'll give you a study that I learned about a few years ago that I thought was fascinating. Okay, let's take somebody with schizophrenia, and at age 21 they have their first what we call psychotic break, where they're showing symptoms. Okay. If we take that 21-year-old and we provide treatment very quickly, medications and therapies and lifestyle changes, and that person continues with all of that treatment, and we take a picture of their brain, that brain remains unchanged after that first break. We take another person who also is the same age, has the same diagnosis, and they have relapses, meaning they stop treatment, they stop their medications, and their symptoms come back again and again and again. What we find is that the brain actually begins to deteriorate, that the person doesn't bounce back to the same level that they did after the first break, which just really points out how important it is that we treat it right away and that people remain compliant with treatment, and therein lies our biggest challenge.
Well, what is the deal with people who don't discover some of these issues? I mean, almost anything, could be applied to this until they're 15 or 18 or 20. I mean, does this stuff just pop up later? Mm-hmm. So it just develops?
Yeah, I was reading somewhere that, women, schizophrenia will manifest in women sometimes later, like in the 30s, before they start to realize that they're really having a difficulty managing their lives.
So can you safely say then they're not born with that? Or are they born with it, or is it genetic disposition?
Oh, there's a big argument about that one. If the right things came along, would that disease never get triggered? There's one of those things we just don't have an answer for. I believe that, like all chronic illnesses, environment plays a role. Okay. For example, I believe I'm a diabetic waiting to happen because it runs in my family like crazy. It's why I run a lot and I keep my weight down and really do, lifestyle things that reduce my risk of developing diabetes. I'm convinced that if I put on 50 pounds, Keith, I'd be the next messing walking around with diabetes. I'm sure the same is true for mental illness. I might have the predisposition for depression. But if I grow up in a nice healthy family with a lot of support systems and I develop really good coping skills, I may never get the symptoms of depression because I got all these things that are positive risk factors. On the other hand, I could have picked my parents poorly and be abused or neglected and not learn skills well, and that's going to increase my chances of developing.
You could have picked your parents poorly? I caught that. I didn't think you really had a choice there.
No, we don't, unfortunately, sometimes, yeah.
Well, I want to make sure the audience doesn't listen to this and go, these people don't really know what they're talking about. It sounds like a bunch of hocus pocus, because you guys do a lot of good stuff. Why do people come in to you guys?
To see us? When they come in to see me, they're usually looking for help with their weight, stopping smoking or cholesterol management, blood pressure, that kind of thing. So we do a lot of diabetic education, nutrition education, and exercise education and counseling.
Just your opinion about this. We live in a region, the state of Indiana, Northwest Indiana. Obesity is a huge issue here. We're at the higher ranking in any place else in the country. It's not good to be at the high ranking.
Right.
How much of people's mental health issues begin to play in once they are really heavy in that self-esteem or whatever plays in?
It's so hard to tease it out and pick it apart. If you're overweight and you're running a high blood sugar and you're on psychotropic medication and you're sedentary and you're not eating well because you can't afford food,
you're smoking too
you have
much.
a multitude of factors that are affecting how you feel, so it gets really hard to kind of figure out. But good nutrition and exercise helps everyone. So that's a standard of practice.
We should send that message out, right?
Absolutely. Again, it's one of those preventative factors for developing mental health issues, is that if you practice good lifestyle things, exercise, good diet, sleeping the right amount of hours, doing something in life that's satisfying and gives you some sense of satisfaction or accomplishment, these are preventative factors for mental illness. Conversely, not having those things, being sedentary, being overweight, having a very boring lifestyle of sitting at home and watching four walls, greatly increases the likelihood of mental illness.
Do people just not know this, or is it just way too hard to break the habits?
Yeah, I think it's a combination of things. I think sometimes people aren't, some of the people that we work with aren't exposed to the same kind of health messages that you and I are. Sometimes they just don't have the messages. It's hard for some people to get to their primary care providers, to get the information. And sometimes primary care providers really don't, they're a little bit inept, or, kind of fumble around with how to talk with people sometimes, about diet and exercise. So, it's not that the information's not out there, but for instance, it's hard for people to think that wellness is for them too. think of the people that you know in your life.
It's for other people, right?
That's right, yeah. Other people should get off the couch. Right. Or other people should stop eating donuts,
But they're okay for me. Okay. Well, back to this continuum, this is just kind of fascinating because in some ways you could almost say we all live with some level of ill health, mentally and physically. So at what point do you continue to move up or down the ladder to becoming more and more serious, and how much control do we really have over that, and how much of that is, again, genetic or environmental?
Well, again, I see mental illness just like a physical illness. We have no control over whether we're going to develop a disease. That again, except for the risk factors, okay, if I exercise every day, I'm less likely to have heart disease, okay, but I could still get heart disease.
But if you're going to get cancer, you're probably going to get cancer.
That's right.
Yeah.
There's some, evidence to suggest that our lifestyle will determine whether you get cancer or not. You can have the gene, think of the gene for breast cancer. You can have the gene for breast cancer and never get breast cancer. Part of it is your lifestyle, your diet and how you live your life.
Yeah. So again, I think it becomes so critical that at an early age that we do deliver that message to our children and to families that what we do really matters and counts, and that there are a lot of preventative things that we can do. One of the things that we do spend quite a bit of time and money on is preventing people getting addicted to drugs, okay? And we find things like, some of this is real common sense, that if I come from a family with two parents who care about me, I am less likely to develop addictions than if I come from a one-parent household, or I come from a family where parents are too busy to pay any attention to me, okay?
Right. Well, I've heard you talk, Jake, a couple times about kind of the statistical pool of these people. Again, we talked about 1% with schizophrenia. What is this group of people? How big is this group of people who just really have issues? And what's that next group that's like really struggling too? What percentage of our population falls in that, both mentally, physically?
Yeah, I think, again, I don't have the exact numbers at my fingertips, but I would say roughly about 10% of the population is dealing with what I would consider a significant mental illness. The most common ones are mood disorders. Depression, anxiety, bipolar, which is both being depressed and being very manic or very high. So again, that's a sizable number. Adjustment disorders that become so severe that they're problematic. Conduct disorders in kids, where they're acting up so much that they're having trouble in school. The number seems to be right around 10%.
How can the average person who just lives with some of these people who are hidden away notice some of these things or help people? What could they be doing to kind of guide them?
Mm-hmm. Well, certainly noticing changes in behavior, changes in patterns, or a loss of usual routines, that kind of thing. And it always is a good idea to think about the physical health part also. It's always a good idea to think of like anemia, for instance. If you have depression and anemia, it's a good idea to get a good physical checkup if you're dealing with things.
Right.
Mm-hmm.
So what else can people do then? Just to help notice that or help people who are in this bubble that could move into that 10%?
I always think that a good thing to do is to, again, notice changes. That I really agree with Olga that when mental illness really becomes a factor, you'll see changes in the way people function. If I have a kid, if my daughter, let's say, for example, was always on the honor roll and doing well, and all of a sudden at age 17, she's getting C's, D's, and F's. Well, that's a big change in her, okay? That there's something real different about her, and at that point, it's time for me to sit down and begin to talk to her and get a sense of what's going on, or begin to, to look around and say, what's going on here? The other thing is that at that point, it may be time for me to get some help. And the one thing I guess I want to emphasize the most about mental illness, it's extraordinarily treatable. That, I tell people, a lot of folks say, oh, how could you work with, all these crazy people and these damn drunks and alcoholics? And my response is always, this is actually a very hopeful population to work with, because if they follow treatment recommendations, they are very, very likely to improve and get better. It's not always so true with somebody who has cancer or heart disease. Okay.
Well, we're getting toward the end, and I want to make sure that there's at least a message out there too. Resources have really dwindled the past few years for healthcare and some of these, despite the fact that we seem to be trying to change the law.
Right.
We're still seeing a lessening of those, correct?
Absolutely.
How dramatic is it?
Well, it's so dramatic that at Regional, we've taken a position where we're doing some of those physical health monitoring. You know, when people come in to see their psychiatrist, we're taking blood pressures, checking weights, you know, just trying to help, you know, bridge that gap and do the maintenance, you know, make sure people get to their doctors when they need to.
Well, I appreciate you both being here, and this has been enlightening to me, and I always feel if I can learn something, maybe everybody else can too. So thank you for all that you do trying to help those in our community. Really appreciate it, the dedication you both have. Thanks for being here.
Thank you, Keith.
Thank you, Keith.
All right.
This was
Most of us don't do a very good job in relating to people who suffer from some form of mental illness. When the illness is profound, we have an even more difficult time. We notice the person standing on the corner looking lost. We raise our eyebrows at the person who explodes in a crowd. We try to avoid the person who's walking down the street and talking to himself. At work and in our families, we are perplexed by someone who has completely withdrawn or is always sad. We're not sure what to do for the one who seems to be moving toward a bad ending. Sometimes we are uncertain how to handle the situation. Other times, we're just scared. When I include alcoholism, drug abuse, domestic violence, and other such ills, we are pretty overwhelmed with how to approach or handle those situations. Most of us just avoid it until it's in our face. There's a moment in the movie Hoosiers when the exiting coach says to the new coach, "There are two kinds of crazy. One when a guy runs naked and howls at the moon. The other is when he does it in my house. The first I can ignore, the second I have to deal with." I'm afraid that's how many of us treat mental illness and other kinds of psychological problems. We wait or avoid until we are forced to deal with it. We just don't understand and are not equipped to handle people who are suffering. We need to remember that we do not have to be the therapist. Demonstrating interest and respect can go a long way. Sitting down and seriously asking someone how they're doing is a start. Listening and trying to understand what is going on can help us be more comfortable, and consequently the other person can feel a little more at ease. Knowing that someone cares can be a huge help to someone who is struggling. Secondly, we can ask that person what they are doing or what steps are they taking to handle the problem. Encouraging someone to follow a plan and seek or continue working with a professional who is trained is important. Lots of people have problems. They're all around us. Ignoring and avoiding does no good. Be smart, not afraid. Your caring could mean so much to someone in pain. Thanks for watching our show. We'd like to hear your thoughts. Did we help you understand this issue better? Email your comments to focus@lakeshorepublicmedia.org or reach us through our website, which is listed on your screen. Join us next week for another Lakeshore Focus. I'm Keith Kirkpatrick saying, make a positive difference in our world today.